All right, let's talk about general compliance so that you have an idea what we actually provide to the doctors. So this is an actual training that we do for a dental office, okay? We also have the medical version also in your handout. Okay, the only difference between the medical and the dental is some of the terminologies are different. Does that make sense? So instead of, for example, exam room in a medical office, we call it operatory in a dental office. Okay? There's certain equipment that are only for dental offices and not so much for medical offices. And then there's some medical devices that dentists don't use. Does that make sense? So you'll learn the differences as I go through the product knowledge. And then we're also going to have a whole day on inspection. So we're actually going to go through this dental office here, and we're going to walk around. We're going to see this entire, facility. We're going to walk around and see how we actually do an inspection, okay? So that's what's going to be. So let's take an understanding, first of all, what is Occupational Safety and Health Administration, or ACT, which is OSHA, okay? Occupational safety, what does that mean? Work-related safety, right? So focus of OSHA is on workers, right? Workers or employees. Employee safety and health. That's the focus. So what is OSHA's job? OSHA's job to make sure that employees are conducting themselves in a safe manner, that employers are training them on safety issues. God forbid something happens to an employee, that the employer is going to do certain things to treat them, to send them to the hospital, to get all the, what we call post-exposure evaluation and follow-up. Does that make sense? Also to do certain preventative things, especially with regards to bloodborne pathogens, such as offering them hepatitis B vaccination. That's a requirement by OSHA. So every employee who deals with blood or other potentially infectious material in a work area, in a workplace, has to be offered hepatitis B vaccination. They don't have to accept the offer. The employer's only job is to offer it. Just got to do it in writing, and they have to either sign a declination, means they don't want it, or sign an acceptance, means they want it. And if they decline it, they don't have to give a reason. They don't have to prove that they had vaccines before or anything like that. It's just a simple yes or no. And they can change their mind at any time. Tomorrow they can come back and say, I talked to my doctor and my doctor thought, it'd be a good idea to get a vaccine. And if they accept the offer, the clock starts from that day. They have 30 days to get it started. Otherwise, the employer is no longer obligated to pay for it. So that's a big issue. What's the most common cause of an inspection by OSHA? A complaint. And it's usually from a disgruntled employee. One of the biggest fear of dentists is that when we go and we start teaching about safety and things, that we're actually educating their employees how to complain against them. So you have to be very careful that when you do a walkthrough, for example, okay, that you don't start pointing out all the things that are wrong. That's not for the employees to know. That's for you to report only to the doctor. It's kind of like presenting something to someone who could take advantage of the doctor. Does that make sense? So some things are just for the doctor. Some things you want to talk to employees about. So when you talk to employees, you want to talk about all the great things that the doctor is doing to improve their health and safety, right? That makes an employee feel good. So be very careful. We've had people I've trained, on inspections, and they walked in and they thought for some reason, I don't know why, that if they scare the employees on how horrible things are, that somehow they're going to score with the doctor. Our primary focus is to protect the doctor, period, end of story. So normally what I do is when I walk around, I notice things, right? I make a mental note and I just say, thank you so much for showing that to me. Thank you so much. And I say, by the way, where's your safety manual? Oh, we don't have one. Oh, don't worry about it. That's fine. And I keep going like that, right? Eyewash station, no, we don't have that either. Don't worry about it. That's not uncommon at all. And those are my comments to the employees. I make it sound like no big deal. I never say, oh my God, you don't have an eye wash station? That's a serious violation. That's $25,000 fine.
I have a question.
Yeah.
So why don't we schedule the walkthrough at the time that the employees are not there?
You don't need to. You want to actually not show that you're hiding anything. But don't say anything, that's all. So when you're talking to the employee, compliment them on how clean the office is, you know, how great they're doing, and if she did something correctly, compliment them. So if they have a safety manual or safety data sheet that she put together and she's very proud of it, compliment them. Wow, that's amazing, good job. Where did you learn how to do that? Wow, I haven't seen a safety data sheet this good in a long time. Great job. Excellent. Did you go to a seminar? Yeah. That's what you want to do with employees. You want to build them up, right? Keep all the negative to yourself. And when you're sharing it with a doctor, you also do it in a nice way. You don't ever say to the doctor, oh my God, thank God I got here today. Otherwise, you'd be in so much trouble. What do you say to the doctor? Yeah, you probably didn't notice that, but you might want to, you know, make sure you don't do that again. That's not the best thing to do. You know? You follow what I'm saying? Don't ever try to scare a doctor into doing anything. Okay? They will back up in a corner and go like this. And you'll never get through that wall again. You'll never get through that wall again. Once they lock up on you, you might as well just walk right out the door. So it's so important how to talk, what you say, when you say what you say at the right time. Make sure you're mostly complimentary in whatever you say to the doctor. Don't get serious. Okay, go look yourself in the mirror. Make sure you have a nice open face. Make sure you're smiling. Okay, you don't have to be flattering, right? But you also don't want to be a grumpy person, because sometimes people go into, yeah, you know, that labeling is not correct, not good. Okay, you don't want to be like that. But I want to talk about what is the definition of a serious complaint. A serious complaint, according to OSHA's definition, is any situation that could cause permanent or prolonged impairment of the body or death of an employee. Let me give you an example. If I said to you, hey, I went to Dr. Hannah's office as a patient and it really smelled bad. I couldn't stand the smell. It was a horrible smell. Is that a serious complaint?
Depends what the smell is.
I didn't say what it was. I just said it was horrible smell. That is not a serious violation, you understand? Or complaint. But if I said I smelled gas, is that a serious complaint? Right here in this office, a patient was driving out from the parking right here. And if you notice on the front of this used to be a house. I'm sure you can tell. This is a converted home. There's a gas meter there. See on the left? When you drive out or walk out, you can see. Somebody bumped right into the gas meter and blew the thing completely open, and gas started leaking everywhere. They blocked the whole entire city and evacuated everybody from this whole street, Birch. This happened just recently. That's a serious situation. Does that make sense? You guys remember what happened in San Bruno and all that, right? So there's a complaint, and then there's serious complaint. Let me give you another example. As an employee, if I said, hey, you know, I've been working for Dr. Javidan for 5 years, and I've never been trained on bloodborne pathogens or anything else. This is a serious complaint.
Yes.
Yeah. Or I've been working with patients, and I've never been offered hepatitis B vaccination.
Yes.
Or as a patient, I walked in and I noticed blood splatters all over the walls.
Yeah.
I walked in and I noticed garbage was overfilled. No. I noticed sharps container was too full. Needles were sticking out of the sharps container. You get the idea? Right? Electrical wire sticking out of the wall. A broken cover outlet. Yeah. It's something needs to be fixed, but it's not a serious situation. Does that make sense? What's the second most common cause of an inspection? Work-related injury and illness. That's the second most common cause. Workers' comp claim is automatically sent a notice to OSHA. Whenever a workers' comp claim is generated, OSHA is automatically notified. Why are they both in cahoots? Because they end up paying for the injury, right? The state of California pays for workers' comp claims and things like that. Does that make sense? So you have to be understanding that if you have too many workers' comp claims, you're going to get reported to OSHA, and then after a certain period of time, they have this rating called Experience Modification Rating, or XMOD ratio, they call it. And if it's over 125% XMOD, you could be targeted for an inspection. And the first thing an OSHA inspector will ask is, were you compliant before this injury happened? The last question is, was this employee trained properly? Were they offered hepatitis B vaccination? Did you have periodic safety meetings? Did you have annual fire evacuation drills? On and on and on and on. Does that make sense? Was this injury reported properly? Documented properly? These are the things that OSHA cares about. Does that make sense? Now, we teach our clients to make sure that if an injury occurs, that we learn from it. We come up with new policies and procedures on how to prevent this from happening again. Let me give you a perfect example of an actual case. Right here in San Mateo, the doctor was giving an injection to a patient. So she comes in, she's wearing complete protective equipment, mask, eyewear, gloves, right? Ready to go. She comes in, she retracts using her finger, index and thumb, like this, right? To give an injection. Something flies into the patient's eyes. Patient moves uncontrollably, it's a reflex. Needle comes out of his mouth, goes right into her thumb. Okay? One slight problem, patient was HIV positive.
Oh no. Wow.
And she had just aspirated. You guys know what aspiration is? Okay, what is an aspiration? Aspiration, so when you give an injection of lidocaine, an anesthetic, you want to make sure that when you give the injection, you give it into a tissue, not in a blood vessel. Does that make sense? Because you don't want lidocaine going to the blood vessel right into the heart, okay? That could cause many serious complications. So you want to be in the tissue, right? In the muscle tissue. So what dentists do, that's why you have this little loop around the syringe where your thumb goes in. The idea is to be able to pull back and forth like this, right? So you give an injection, you pull back, okay? And if you see blood come through the carpule, that means you're in the wrong place. So you have to pull back and try another spot. That's called blood aspiration, okay? And so she had just aspirated too, so the needle was full of blood when she got poked. So worst nightmare of a dentist. She was a young dentist, just recently had gotten married. Her whole life changed for the next year. Because for a whole year, you don't know if you got HIV or not, okay? Because that's how long it takes to incubate, usually. But she has to go and take some medications, really, really nasty medication. They call them antiviral medication for HIV, which is almost like chemo. It makes you sick, you throw up, it's horrible. She had to take it for a 4-week regimen, but then she found out the dosage was too strong for her, so she reduced the dosage, went for 8 weeks. And then after that, she was just, doesn't know until a year. So she was sharing with me she didn't get close to her husband for a year. Imagine what kind of a strain that does on her marriage, right? Wanted to have a baby, she had to postpone that whole plan for a whole year. Now, thank God, after a year, she came clean. There was no HIV. But for a whole year, her whole life just turned upside down. Now, all she had to do was follow the policies that we had taught her in training, and this would have never happened to her. So what do you think the policies that we teach that could have prevented this from happening? Don't use your fingers to retract. What else can you use to retract? The mirror, the mouth mirror. See, if my finger is nowhere near that needle, what happens? I don't get stuck, right? If instead of my finger, this thing here, right? Where's my finger? Where's the needle? Right here, right?
Far apart.
Yeah, far apart, right? That's a very simple thing.
Yeah.
And what else could she have done? Put eyewear on the patient. Let me ask you a question. Who remembers their last visit to their dentist? Did they make you wear eyewear every time?
Yeah.
Excellent. Best policy ever. How about you guys? No? Well, next time you go to your dentist, you make them give you eyewear. And it's not just to protect you, but it's also to protect them. In this case, it would have protected the doctor, because if the patient was wearing something over their eyes, whatever flew into their eyes would not have entered. Does that make sense? Simple, real simple procedure could have saved a year worth of misery, right? And how much damage those medications did to her, who knows? Because this kind of medication could cause birth defect, all kinds of problems, right? Does that make sense? So we teach to learn from these mistakes, right? And we actually save lives, guys. So be proud of what you're presenting to your doctors as products and services. So we teach our clients how to document these incidents. We teach them how to learn from past incidents, come up with policies and procedures, new policies and procedures, and how to properly train their staff. Hey, here's how I teach my staff. I teach first the concept, then I what's called quiz them. I say, okay, so what do we do with patients? We put goggles on them. We don't retract using our fingers, especially a known HIV patient. And drilling. Drilling means watching them do it, which completely, concludes the training, right? It makes it stick in their mind. So you teach it, you quiz it, and then you drill it. You can do the same thing with each other, right? Anything you want to learn, anything you want to really hone and retain, you want to teach it, you want to quiz each other, and drill with each other. Okay? So find a tag team, a team player, and start drilling with each other and quizzing each other so you can retain this material. Because there's a lot of information. It takes a while to learn everything. Don't expect to learn everything today or tomorrow or next week. This is an ongoing process. Okay? And always remember that doctors will not know as much as you know. By the time you're done with this training week, you're going to know way more than doctors would know. I just want you to feel confident that, they're going to know less than you, okay? So you don't need to be intimidated at all. Does that make sense? Have the confidence, okay? And if they ask you a question that you don't know and they stomp you on something, just simply say, you know what, that's a very good question, doc. I'm not sure what the answer is. Let me find out for you right away, and I'll get right back to you. And what do? You call us. Hey, Dr. So-and-so just asked me a question. I didn't know what the right answer is. We give you the answer right away. And sometimes if we don't know the answer, we'll research it and get back to you. Okay? Don't ever make stuff up. Because sometimes the doctor's asking you the question, but she already knows the answer, and she's testing to see if you're full of crap or not. Don't ever try to BS a doctor, okay? ever. It'll bite you in the, you know what. And then you don't know what happened, why this doctor all of a sudden is no longer interested in working with you. Because she caught you in a lie. Okay? Don't ever, ever, ever lie about anything or exaggerate something or say something stupid that you don't know for sure if it's true or not because it made sense to you. Most of this stuff doesn't make sense at all. It's just the way the law is. Does that make sense? All right. What's the least common cause of an inspection? A random visit. Let me share with you how random visits work. Random visits work like this, where OSHA sends a letter out to people who make a complaint about you. Let's say an employee made a complaint or a patient made a complaint about the fact that your place was dirty. Not a serious complaint, doesn't require an inspection. So what does OSHA do? Write you a letter. And this letter comes to you in the mail and it says, Department of Industrial Relations, Occupational Safety and Health, blah, blah, blah. And it says, we're in receipt of a complaint alleging blah, 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 blah about your practice. You know, like you're not doing this correctly, your place is dirty, your place smells bad, blah, 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 right? That letter that they receive, okay, is not a serious complaint. And all you have to do is write a letter back as a doctor to say, hey, no, these things are not correct. Our place is nice and clean. Here's some photographs of our office, and that's the end of it, right? Now, by the way, if you ever get a letter like that as a franchisee, in other words, one of your clients gets a letter, okay, you're going to send that letter to us, and we'll write a response on the doctor's behalf in a Word document. We send that letter to you, okay? You send it to your client. They put it on their letterhead, and then they send that letter to OSHA on their letterhead, okay? I've written 300-400 of these, okay? And we've never had one turn into an inspection or any fine at all in 20 years, knock on wood, okay? So the doctor receives the letter, okay? When they tell you that, oh, I got a letter from OSHA, okay, you're going to get a copy of that letter, you're going to send it to corporate. We'll write a response on behalf of that doctor. We send it back to you, you give it to your client, he or she puts it on her letterhead and sends it to OSHA. And it usually is the end of it. Now, why am I bringing that up? Because random inspections happen to be every 10th letter that OSHA writes, the 10th person that gets a letter gets an inspection. Isn't that crazy? Yeah, the unlucky 10.
So it's not that the doctor has to get 10 letters. It could be their first letter.
That's right. So every 10th letter that's written by that particular office, that particular month, or that particular day, if it happens to be the 10th person, they're the unlucky person who just going to get an inspection, a surprise visit. This is a fact. This was told by us by an actual inspector. It's not something that's known or publicized, but that's what they told me. It's kind of like pulling their name out of a hat. Regardless, your clients, you got to be ready for inspections. You have a question?
I just wanted to know, it says 11 plus employees, so if it's under 11 staff, then there is no inspection.
No inspection, random, yeah. So it's 11 or more employee facilities are the ones who get inspected randomly. They don't care about little offices to do a random inspection. So the small offices, only complaints or injuries could cause an inspection. Now, a lot of people ask me, what if a doctor doesn't have any employees? You know, there's some doctors who are just solo practitioners. They don't have any employees. So what happens with them?
A lot of times they're not compliant.
Yeah, but does OSHA have jurisdiction over a doctor who is the sole proprietor?
If he's not a corporation, no. If he is a corporation, yes.
Yes, good job.
He's an employee
Of his own corporation, right. So that's what you got to ask. If a doctor is sole proprietor by herself, non-incorporated, then he's exempt from OSHA regulations because there's no employees. But if he's incorporated, like a professional corporation, which most dental offices and medical facilities are, then he's an employee of his own corporation.
Same with LLC, right? LLC.
Yeah, I think LLC also is considered an employee of the LLC, yeah.
For liability reason, there should be a corporation anyway, right? I mean, anybody.
Not always.
Not always, no.
Most of the older doctors are not incorporated.
Yeah, a lot of them do it for tax reasons and also for liability, but the older doctors, most of them are just sole proprietors. They don't ever become a corporation or never became a corporation. So you have to ask that question, okay? Now, is that doctor a candidate for OSHA? No, but is he a candidate for HIPAA? Absolutely. Is he a candidate for medical waste?
Yes.
Absolutely. Is he a candidate for IT? Absolutely. He's probably an older doctor, so he's definitely a candidate for document management, right?